Hi, my name is Nina Peña, and today I'm here at CSA Aesthetics. I'm the owner of Lania Beauty Salon, and I've learned CSA from my mom 6 years ago. And the first procedure I had here is facial and non-surgical nose threading. So today I'm here, it's because I wanted my face to look a little bit smaller. As you can see, medyo chubby cheeks ako. As a businesswoman, I face a lot of people or clients every day. And of course, I want to look my best. So wait na lang natin kung anong gagawin sa akin ni Doc today to achieve that perfect V contour. Don't forget to click the subscribe button and the notification bell to keep you updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a so-called V contour for the young. Let's all welcome Miss Nina Peña. Welcome, Nina.
Hi, Doc.
Right. So we have a young client for today. Because in the past, recently, like we have, of course, those who are in my generation, right now in Nina's generation. She's still young, she looks a baby. Okay? Right? I don't want to ask her age. Okay. Anyway, so for this part here, usually what we do, since Nina is our new guest for now, we start with the so-called assessment of the face, right? You've heard of that, Nina? Right. I'm so excited to have Nina because I've known Nina for quite few years. Ilang years na?
4 years.
Oh, yeah. 4 years na.
4 years.
Okay. Laking
Or
CSA.
mom, 6 years.
Oh, yeah. My mom is 6 years. So, she's growing with CSA and over time, because she's an, what do you call this? An entrepreneur, right? She has a business right now. And those people, I think I've noticed, no, people with business, they have like a stressful lifestyle also. They think about how to make their business grow or earn, right?
Yes, so.
Is it stressful?
Stressful.
Oh, okay. And when you have stress, what's happening?
Ayun. Mga tumatanda.
Ayun. So, some will notice lines, some will notice grooves, creases on the face, or starting to sag, right? So, I actually asked Nina a while ago on her face, which side did she notice like there's already like, you know, some beginning sagginess there, droopiness there, or is she seeing lines there, or anything that's unusual, right? She was sharing with me, she noticed there's like an asymmetry also on her face. And she felt like the right side, right? It's saggier than the left, correct?
Yes, sir.
Yeah. And actually, I was assessing her while she was explaining it to me. I really noticed mid-face to the lower face. So in the mid-face section already, you'll notice a beginning mid-cheek groove, okay, the Indian line. And this one, there's actually a ligament here that's starting to weaken, okay? And you'll see like a beginning sunken or hollowness here, or a groove, or we call it Indian groove, mid-cheek groove. Then beneath that, the nasolabial fat compartment will start to go down also, causing this deep nasolabial crease here. Na-notice mo rin?
Yeah.
Yeah, this part, no, midsection, no, mid-face. And then when we go to the lower part of the face, this one, niya. So, notice na natin, there's this fat tissues here, or the jowl fats, they begin to go down too, and will cause this marionette line. But she's still young eh, di ba? Ano ba, 20s?
Yes.
Or ano na, late 20s, something like that. Okay. And for your age, of course, you have to do something, a treatment that will, of course, delay or rather stop the aging process and improve the looks of the face. And of course, still highlight the beautiful parts of the face, right? She's still young eh. So we wanted to do something, of course, non-surgical, and it will give a natural result. And of course, safe procedure, because that's your concern also, kung safe ba, di ba? So what kind of treatment, what procedure, we will show you when CSA Medical Aesthetics returns. And we're back, so we're doing a procedure for Nina. Okay, we also want to achieve a so-called V-contour for Nina. And at the same time, we want that restoration of lifted face, tight skin, firmer skin. And we want to treat the ones we had mentioned a while ago regarding the beginning mid-cheek line and the beginning sagginess on the nasolabial as well as the jowl area. Okay, so we can do treatments for those, we can target those, and I'll be starting with the treatment on the so-called the masseter area. We'll be injecting a botulinum toxin, okay, Nina? Because we want a V-contour. For women, it's ideal that on the lower third of the face, it's narrower, it's slimmer, it's smaller, okay? Although there's a certain like normal vertical dimension or the height, we have to follow that too. So I'll be starting with the treatment of the masseter, and I'll be using botulinum toxin. Nina, I need you to turn to the left side, okay? So for the masseter region, we've already known this. When you make your markings for the masseter, so your corner of the mouth to the tragus, that's the upper border, and then jawline is the inferior border, and anterior, that's the anterior border of your masseter muscle, and then posteriorly, this part here, okay? So I already palpated actually the masseter of Nina, right? So actually, there's a strong contraction, and we want to somehow slim also the muscle mass. Okay, I'll be using botulinum toxin. Okay, my standard unit for this side, I always start with 30 units, but it's a case-to-case basis. For people with bigger muscle mass, I add more, 40, 50. So you have to do your assessment too. Okay, so you're ready, Nina? Okay. So a while ago, actually, we applied topical numbing cream. They cleanse the skin. And so when we inject already, we're ready. Okay? Tama niya. Okay. Because he was asking me, Doc, hindi masakit. Okay. I'll be very gentle. So my finger is here at the anterior masseter. So I'll make a 3-point injection. So starting here, okay. You can actually ask your patient to like clench the teeth so you can really feel the strength of the masseter. Okay, I'll be injecting first a 10 unit here, and then after that, we'll be going to the superior aspect here. Okay, can you bite for me? Okay, so I'm actually feeling a strong contraction here. We were able to inject that already. So a little bit higher than that, I can inject another 10 unit. So 10 unit here again. You're still okay, Nina? And then I'll go to the some posterior inferior aspect, another 10 units. So that's for the right masseter. So it's a simple technique, 3-point injection using 30 units of my botulinum toxin. Okay, then let's proceed to the left side, right? You can also ask them which side is the one that you always chew on. Like for example, Nina, do you always chew on this side, left side? Yeah. And then when you palpate for the muscle, it's stronger than the other side. Okay, bite nga niya. Okay. So actually, upon assessment, kind of this one is stronger. Okay, and really that hard. Okay, niya. So the side where they always chew on, that side has stronger muscle. Okay. So I'll make my injection. So same again, the markings, and then you palpate for the masseter, and then stay 1 cm behind your anterior border of your masseter to avoid your risorius muscle here, so that there will be like avoidance of a formation of an asymmetrical smile. Okay, and then posterior to that, so 3-point injection technique again, 10, 10, 10. Sometimes we use like 8, 8, 8. It will depend. Some will use 6-point injection, some will use 5-point injection, so it varies. Usually, the botulinum toxin starts to work in 24 hours and then to 2 weeks. Then we tell them like they'll see the result in 2 weeks time. So they just feel like the masseter muscle is kind of like less chunky or something like that. So you'll notice that your face is becoming slimmer too. People will notice like, wow, you lost weight, something like that. Pumayat ka, something like that. So we're done with the botulinum toxin for the masseter. So that's part of the V-contour method, okay? So we want this jowl area here and the mid-face section here somehow lifted, and at the same time, they will form like a V shape on the face, okay? Now, I'll be using my PDO threads, the screw type of PDO threads. I don't know if you've heard of that, Niña. So we'll be using a PDO screw type, okay? Not the usual monofilament or mono or simple, plain, smooth kind of thread. So we also have the so-called PDO screw thread. We're using PDO screw for you. And actually with that one, actually they notice that there's a stronger lifting and more stimulation of the fibroblasts and more collagen stimulation. If you have like a type of a thread, it's like coiled around the needle, okay? So it's not a simple plain, it's not a simple straight or smooth type. It's like coiled or intertwined in your needle, okay? So for the mid-face section, I want to correct the beginning mid-cheek line and also the sagginess here. You're excited, Niña? Yeah, which is also your concern, right? So here, this part, we have the so-called ladder technique, okay? So if you draw a line, corner of the mouth to this superior border of the ear, and then from your alar to the temple region, and then make your parallel lines like that. So that's so-called also a ladder technique. There's also a mesh pattern technique. Mesh pattern is like creating crisscross, okay? Or there's also like the fanning technique like that, okay? For now, I'll be using the so-called ladder pattern. Then later on, I'll also assess, I might combine with like a crisscross or a mesh pattern, okay? So we have patterns that we follow in doing our PDO thread techniques. For now, we'll start with the right side. You're ready? Ready na po. So I can again disinfect the region. Okay, disinfecting. So the basic technique that we do, the so-called ladder pattern, is like when you do series of your threads like this. But later on, I'll combine it also with a mesh pattern because there is a sagginess already in this section. So for this part like this, okay, so this is a PDO screw type of a thread. It's a gauge 29 with 38mm length of our needle. Okay, so you'll notice that they have this pink needle hub. There's a white sponge there. So we really have to insert the entire length of the needle, okay? So we leave them first there for hemostasis, and we will be using like 10 pieces on this side here. So this is the so-called step ladder pattern technique, okay? So we've used 2, 4, 6, 8, 10. Now when you pull out, you have to twist, 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 twist. So-called mechanical stimulation of your threads. Okay, and one time pull. So that's one technique. Another technique is the so-called, like you can do a mesh pattern. Mesh pattern is, or like a crisscross pattern. So we did like a diagonal like this. We can also do like a direction like this also, okay? So like we're going to direct our needle towards the temple region, okay? So you can do also this. So we are combining techniques. This is the so-called, you can do a mesh pattern already, like crisscross. I noticed also that Niña has pimple marks, right, Niña? Pimple remnants, okay, the souvenirs, or some pitted marks, pitted scars. Okay, our BDO threads will also help in the improvement, or rather the correction of those pitted marks. Now, there's this other pattern we call also like mesh fanning pattern. So, I still wanted to improve this part here. Okay, Nina, I want to give you really an improved skin texture since you also have this mid-cheek groove here. So, like this will be my entry point. Okay, this is to improve that kind of mid-cheek line. So, I can do a so-called like a fanning method here. So 1, 2, 3, 4, 5. But your entry point is just one section there. Okay. But it's a fanning technique, okay? So this will help in improving our acne scars also. And plus really making our cheeks restore the OG curve or the natural convexity, okay? So take note, this will form collagen. 12 weeks time, there's neovascularization, there's like formation of growth factor peptides that's really gonna rejuvenate your skin. And now for our lower third of the face here, so we're doing the right side, okay? So this side will explain. We'll do a so-called like, for our V contour, our vector will be like this for this part here. So we wanted to lift the skin here. We can do a pattern like this. So it's like towards your temple region again. You're still okay? Yeah. When they ask me about this, it's like doing acupuncture and it's a tolerable procedure. So like I direct my threads to that upper layer. So since I'm working on the jowl area, now I can combine again with the so-called mesh pattern or the crisscross pattern. So for that mesh pattern, we can also do something like this. So you make an overlapping of your threads. So it's like forming those series of threads. It's like creating scaffolds of threads, structural framework of threads for really strong stimulation of collagen. Okay, so that's for the right side. How are you so far? Initially, you'll feel some like there's beginning tightening already inside, and you feel like your tissues are like becoming like from within. Some limitations of mouth movement because there's beginning contraction. Yun, contraction there. Okay. So we'll have a diet too, Nina. Okay, I was advising Nina, okay, in terms of the food that you eat, we wanted to reduce some of our fatty tissues or fat percentage. We can also do or work on that on your face because actually you're doing like a weight management, right? And you were sharing with me that like your body might be losing weight or reducing fats, but the face is like it's still like you still have a round face or there's more of fatty percentage there. Yung sinabi mo kanina, nahuhuli ang mukha. So we'll do treatments for the face, something to dissolve fat, something to reduce fat, and something to contour the shape of the face. So we are proceeding to the left side. So same pattern, we'll start with the ladder pattern. So we're doing combinations of techniques for Nina, okay? So this is our ladder pattern. So you do a parallel injections like that. Just follow your lines, your markings. So in my practice, I am already like have a certain imaginary line. I've been doing it for like a decade already. So we are okay with our techniques. So that's my 10th. One more. So it's a combination technique. So this is mid-face, correction of our mid-cheek groove as well as improving the cheek contour, the natural OG curve, and we wanted to have a lifted mid-face and a lifted mid-cheek region, okay? So your so-called crisscross pattern or also the like a mesh pattern, okay? So crisscross like a tic-tac-toe or cross-hatching method. So we also wanted to improve the skin texture, some pitted scars from pimple there. And these are PDO screw type of threads. So actually PDO threads have classifications, and we are using those mono threads. So this one is a mono screw type of thread. It's not the mono plain, mono straight. Okay. So I also combine again with the so-called like mesh fanning method here. So I wanted to correct the mid-cheek line there. So start here. So towards our nasolabial line there, or nasolabial fold there. So you do like your fanning method here. So for our doctors doing this, you have an idea of what technique you can follow your patterns, targeting the treatment areas. So whatever your indication is, you just treat that area there that you want to improve. So we'll be working on the jowl region. So for us to improve the so-called marionette line also. So my vector is towards the temple region. So like a V pattern here. So for Nina, actually, at her age, actually we can also combine with our cog threads. Probably next time, Nina, that's our next goal, okay? Because cog threads are really very powerful in doing that so-called lifting method. So you can also direct your screw threads towards the marionette line here. Last time what we were doing was this vector. Now this time we will be targeting the marionette fold. So you can also do this kind of approach. Okay, so we've done this PDO screw threads, mid face, lower face for Nina. We'll show the result when CSA Medical Aesthetics returns. And we're back, so we'll now show the result to Nina. Nina, here's my mirror for you. So we've done a combination Masseter toxin injection, and also we've injected PDO screw threads for Nina. So we'll be expecting a so-called soft tissue swelling right now because there were multiple needles there. Like my PDO screw threads, there was a total of 60. Oh, diba? 60 needle injections. So I am explaining to Nina, expect of course tomorrow some swelling there, and then like with your mouth movement, some you know, limitations, because there are really these screw threads that are inside your soft tissues around the mouth region. And also on the masseter, when you chew, expect some like laziness in chewing, okay, which is like for girls right now who are on a diet and want to lose weight, they like that. So part of the weight loss regime also. And I was explaining to Nina, if she's like, she wanted to do a weight reduction, it helps also to do this PDO thread insertions, because when you wanted to like become slimmer, right? So those people who are going to the gym, or rather like have a calorie reduction or diet, and then when they lose weight, they tend to have saggy face. So the PDO thread insertions will help in preventing that, because we ladies, we want to maintain that right, or rather the ideal body weight. So we wanted to be in right shape, and of course it's part of our health. Okay, so Nina, okay, thank you so much. Kind of like she has a difficulty to speak right now. Thank you for joining us. So if you wanna see Nina, you can visit beauty salon Lana Beauty Salon, or they have an Instagram, Lana Beauty Salon, correct? Or she has her Instagram, it's Nins. Okay, because some of our televiewers may want to ask our guest kung masakit ba. Okay, yan. So she can like answer some of your questions. Okay, and after this, we'll be doing a cold therapy, cryotherapy. We'll be applying topical anti-inflammatory creams because we expect some temporary redness there because of those injection marks. Because right now I can still see some redness, but in a little while that redness will go away. Okay, so no signs of bruising for Nina right now. And then in a week, okay, we just tell them to, like, of course, not too much of heavy or strenuous activities for like a week. And of course, with the diet, soft diet muna. Anyway, I think she's in a program of maintaining the ideal body weight. Okay? Thank you, Nina.
Thank you, Doc.
Now, if you have any questions, you may email us at csaskinclinic@yahoo.com. And we have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And our other videos, please look at our YouTube channel, Contessa Salvador. And God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.